Knock knock.
Come in.
Hello.
Yeah.
My name's Nicole. I'm going to be the nurse practitioner taking care of you today. Can I have your full name and date of birth?
Christopher Castellano, 07/16/1993.
And today we're going to do a head-to-toe assessment on you. First, we're going to start with a general survey. So I'm going to start by asking basic questions to get your mentation, okay? Can you tell me what city you were in?
Henderson,
And what is the month?
October,
And what is the year?
2019.
So based on those answering of your questions, I can tell that you are alert and oriented ×4. And then to continue on with the general survey, you are good hygiene, appearance is appropriate, no distress is noted, your speech is clear, and we can tell that you can hear. So we're going to begin with the head-to-toe assessment. I would be wearing gloves, but we're going to start, okay? So we're going to start by inspecting. Your head is symmetrical, your skin is pink, dry, and intact. I don't see any deformities or lesions noted. I'm just going to touch your hair, inspect your hair and your scalp. Your scalp's normocephalic. Your hair is, there's no alopecia noted, no lice noted in your hair. And then your eyes and your space is symmetrical. So we're going to test your CNS, your cranial nerves 5 and 7. So by doing this, we're going to have you puff out your cheeks. Can you raise your eyebrows for me? Smile, stick out your tongue, okay, and frown your face. Okay, and then what we're also going to do is I want you to close your eyes and tell me when you feel something.
Feel.
Okay, so that by doing that, I can tell that cranial nerves 5 and 7 are intact. Now we're going to palpate your skin. I'm going to palpate, let me know if there's any tenderness. We're going to palpate your sinuses. Is there any tenderness?
No.
So next, I'm going to just touch your lacrimal apparatus. Okay, it's intact. And then we're going to palpate your jaw, right? Your TMJ, okay? You can open your jaw, close your jaw. So there's full range of no motion, no clicking, and no crepitus noted. So now we're going to start by inspecting your eyes, okay? So what we're going to do is I'm going to have you look. Your eyes are symmetrical. Eyebrows are symmetrical. I'm going to have you look up. You can look down. All right, your sclera is white, your conjunctiva is clear, and your irises are round and symmetrical. We're going to next check cranial nerves 3, 4, and 6. By doing this, I'm just going to check your cardinal fields, okay? So I'm going to have you just look straight, and you're going to follow my hand with your eyes, okay? Very good. So by doing this, I can tell that cranial nerves 3, 4, and 6 are intact, and EOMs are intact as well. And I could tell when looking at his eyes that there was no cataracts noted. Next, we're going to do the cover and uncover test. I'm going to have you cover your left eye. Now cover your right eye. I'm going to uncover your left eye. Good. So there's no strabismus noted. Now we're going to check cranial nerve 2. You can uncover. We're going to check cranial nerve 2. First, we're going to do this by checking your vision. So we're going to use a Snellen chart, which would be 6 feet away. And can you tell me with both eyes what the lowest line you can read?
The 2020 LTFPH.
Okay. And then cover your right eye. What's the lowest line you can read?
2020 LTFPH.
Okay. And then cover it again. Your other eye.
2020 LTFPH.
Good. So we can tell that he has 20/20 vision. And next we're going to check for confrontation. So what we're going to do is I'm going to have you cover one eye, and then I'm going to cover the same, and then you're going to tell me what finger I'm holding up, okay, for your peripheral.
3, 2, 1.
Okay. Now we're going to switch to the other eye.
2, 3, 1.
Very good. So we can show that cranial nerve 2 is intact, meaning that in your vision is appropriate. So now we're going to use test for perla. So we're going to look and see if your pupils are equal. equal, round, and reactive. So we're just gonna look at your eyes. Okay. Okay, and I'm gonna have you come straight and follow this in. Very good. So noted, so your pupils are equal, round, reactive to light, and accommodation is noted as well. So next we're gonna look into your eye, we're gonna check the corneal light reflex, red light, and your optic disc, okay? Alright, so corneal light reflex and optic, corneal light reflex, red light are intact and noted, and your optic disc is creamy, yellow, and there is no AV nicking noted. So next we're going to move on to your nose, and we're going to start by testing cranial nerve 1. So I'm going to have you close your eyes and cover one nose, one nostril. Alright, can you tell me what this smell is?
Lemon.
Okay, now we're going to have you close your other nostril, and then unclose that one. Can you take your, thank you.
Lemon.
So that shows that his nostrils are patent and the cranial nerve 1 is intact. Next, we're just going to look up your nose really quick too. No septal deviation noted. Turbinates are pink. Nasal mucosa is pink, and no deformities noted or lesions. Next, we're going to be moving on to your ears. So I'm going to start by inspecting your ears. Your ears have no deformities. They are symmetrical to the outer canthus of the eyes. I'm going to pull on your auricle and your tragus. Is there any tenderness?
No.
Any tenderness here?
No.
All right, so there's no tenderness noted. Skin is pink, dry, and intact. Now we're going to look at the otoscope and look in both of your ears, okay? I'm going to pull the auricle back, the pinna back. Okay. I'll look on this side. Okay. The external canal is pink. Tympanic membrane is pearly gray. No perforations or inflammation noted. And then now we're going to look at cranial nerve 8. So we're going to do a whisper test first, okay? So I'm going to have you cover one ear. I'm going to go behind you, and you're going to tell me what you hear, okay?
Okay. Apple. Banana.
Okay. Now we're going to do it on the next side. So I'm going to have you uncover this ear.
Apple. Banana. 8.
Okay. So next we're going to perform the Weber test. So what we're going to do is I'm going to smack this tuning fork, and you're going to tell me if you hear the sound symmetrical on both sides, okay?
Okay. Yep.
Okay. Next we're going to do the ringing test, and this is you're going to tell me when you stop hearing it, okay?
Okay. Alright. Okay.
Now we're going to try it on the other side. Same thing, okay?
Alright.
So this shows that cranial nerve 8 is intact, and with the Rennie test that shows that air conduction is greater than bone conduction, which is what we want to see. Next, we're going to move on to your mouth, okay? So I'm just looking at the lips. The lips are pink, dry, intact. There's no cracking or dryness noted on the lips. So now I'm going to have you smile. Can I see your teeth? Okay, his teeth are aligned. It looks like he has good hygiene. I'm gonna have you open your mouth, stick out your tongue. Okay, hard and soft palate are smooth. And then we're gonna look into your mouth again. We're gonna test your gag reflex as well. Well, first we're gonna look into your mouth, okay? Just gonna look in, say ah. So his uvula goes up with phonation, and then I'm gonna have you test. We're gonna test cranial nerve 12. So I'm gonna have you stick out your tongue. Can you move it to the left, the right, up, down? So by doing that, that shows that cranial nerve 12 is intact. Next, we're going to look at cranial nerve 9 and 10. So we're going to test the gag reflex. So I'm going to have you stick out your tongue, open your mouth. Okay, the gag reflex is intact. So that means that cranial nerves intact. And while looking at that, I noticed the tonsils are 3+, no white patches or redness noted. Next, we're going to be moving on to your neck. So I'm just going to start by inspecting the neck. The skin is pink, dry, intact, no lesions or deformities noted. We're going to look for, there's no JVD noted on either side. The trachea looks to be midline, no shifts and no deviations. We're going to have you turn your, can you turn your neck to your left and your right? Very good. So next we're going to check cranial nerve 11. So I'm going to have you just shrug your shoulders for me. Very good. So cranial nerve 11 is intact. Next, we're going to check your lymph nodes. You let me know if there's any tenderness, okay? So we're going to start with the occipital, postaurical, preaurical, tonsillar, submandibular, submental, superficial, cervical, postcervical, and supraclavicular. Any tenderness? So there's no lymphadenopathy and there's no tenderness upon palpation. Next, I'm gonna palpate your trachea again. So the trachea is midline, no deviations or lesions noted. We're gonna check your thyroid. So what we're gonna do is I'm gonna come behind you, and then I'm gonna have you just swallow, okay? So swallow. The thyroid rises and falls with swallowing, and there's no enlargements or masses felt. This time we're gonna check your carotids. So first I'm going to auscultate one at a I'm going to palpate one at a time, okay? So your carotids are equal and +2. And then we're going to auscultate with the bell, inspect for any bruits. No bruise noted on auscultation. We're going to check the rest of your, we're going to check your pulses, okay? So we're going to check the radial, check your femorals, dorsalis pedis, and the posterior tibial. All your pulses are +2, strong, and equal. Next, we're going to look and inspect your posterior chest, okay? So I'm going to have you turn around. You can face the wall. And we would, but to keep his privacy, we're going to keep his shirt on. So we're going to inspect his back. The skin is pink, dry, intact. There's no lesions noted, no abnormal moles or anything like that noted. His spine is symmetrical. There's no abnormal curvatures. Scapulas are symmetrical as well. And his AP diameter is 1:2 ratio. Next, we're gonna palpate, so I'm gonna have you take a deep breath. Chest expansion is symmetrical, and then we're gonna test for tactile firmitis, so I'm gonna have you say 99 whenever you feel my hands.
99, 99, 99, 99, 99, 99.
So tactile firmitis is present. Next, we're going to test for CVA. So you let me know if you have any tenderness, okay? Any tenderness?
No.
So there's no CVA tenderness noted. We're gonna percuss, okay? So percussion, there's resonance noted. And next we're gonna auscultate your lungs. We're gonna begin by checking for egophony, okay? So whenever you feel my stethoscope, I want you to say E, okay?
Okay. E. 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 E.
Very good. So I noticed a high-pitched E sound, which is normal, which means that there's no consolidation. So next we're going to auscultate your lungs, okay? So I just want you to take a deep breath whenever you feel my stethoscope.
Okay.
Lungs are clear through auscultation throughout the back bilaterally, no adventitious lung sounds noted. We're going to move back to your anterior chest now, so I'm going to have you face me. So I'm going to inspect your chest. It's symmetrical, there's no deformities noted, skin is pink, dry, and intact. While we're here, we're going to check your cap refill. Okay. And then we're going to check it on your toes. I'm going to take your socks off, is that okay?
Yes.
Okay, I'm going to take your other sock off too. Cap refill is less than 3 seconds noted bilaterally. So next, what I'm going to do is see your shoulders. We're just inspecting still. Your shoulders are symmetrical. We're going to palpate your pericardium, okay? I'm just feeling for any thrills or heaves. No thrills or heaves noted. And now we're going to palpate for the point of maximal impact. And how we're going to do this, this is noted at the 5th intercostal space, midclavicular line. I'm just going to palpate. And I don't feel any thrills or heaves. Now we're going to auscultate there. Next, I'm going to auscultate your heart sounds. So we're going to do this with you first sitting down, and then we'll do it again with you lying, and then you lying on your left side. So we're going to first look at the aortic, which is the 2nd intercostal space, right sternal border. The pulmonic, which is the 2nd intercostal space, left sternal border. Erb's point, which is the 3rd intercostal space, left sternal border. Tricuspid, which is the 4th intercostal space, left sternal border, and then the mitral valve, which is the 5th intercostal space at the apex of the heart, midclavicular line. We're going to auscultate with the diaphragm and then the bell. And now I would do this again with him lying down and then him lying on his left side. So upon auscultation, S1, S2 were present. The heart rate was regular rate and rhythm. No systolic or diastolic murmurs heard. No S3 or S4. So next we're going to have you lay down and we're going to move on to the abdomen, okay?
Okay.
So I'm going to start by inspecting the abdomen. The abdomen is flat, skin is intact, pink, dry, no pulsations noted, no deformities or lesions. So we're going to begin by auscultating. Next, we're going to start in the right lower quadrant, and we will auscultate each quadrant for 60 seconds. After auscultating each quadrant for 60 seconds. All bowel sounds are normoactive in each quadrant. At this time, we're also going to auscultate with the bell of the stethoscope, the aorta, renal, femoral, and iliac for any bruits. There's no bruise noted at any of those arteries. So now we're going to percuss the liver. So we're going to go on the right costal margin, and we're just going to look and see how this dimension of the liver. So the liver is 6 to 12 centimeters at the right costal margin. Now I'm going to palpate. We're going to start with light palpation and then deep palpation. You let me know if there's any tenderness, okay?
Okay.
Now we're going to do the deep, okay? I'm going to palpate for the kidneys. Any tenderness? No tenderness, not palpable. And then we're going to go on the left costal margin, and then we're going to palpate the spleen. The spleen should be non-palpable. The spleen is not palpable, indicating that there is no splenomegaly. And now we're going to test for the inguinal lymph nodes to see if those are tender. Any tenderness? So I'm going to test for Murphy's point right now, which is in the right costal margin, in the right upper quadrant, and that tests if there's anything cholecystitis. Any tenderness? So he has a negative Murphy's sign. Next, we're going to test McBurney's point, and this is in the right lower quadrant, and this is going to test if there's any appendicitis. Any tenderness?
No.
Okay. So now we're going to test the obturator sign. So we're going to have you flex your right knee. Flex your right knee. And hip, and internally rotate your hip. Is there any tenderness?
No.
Okay, so that's a negative obturator sign. Now we're going to do the Rosling sign, and I'm going to palpate on your left lower quadrant. You let me know if there's any tenderness in your right, okay?
Okay.
Any tenderness?
No.
So that's a negative sign. Now we're going to test the Suis sign. So we're going to have you lay on your left side. Now I'm going to have you flex your right thigh back. Is there any tenderness?
No.
So there's no tenderness, means that the Suis sign is negative. So now we're going to move on to the musculoskeletal system. Okay, so we're going to have you lay flat on your back.
Okay.
And I'm just going to start by inspecting your skin, your joints. I don't see any obvious deformities noted. Your skin's pink, dry, intact. And then we're going to palpate your joints, okay? So we're going to palpate your patella. Okay. Palpate your ankles. Any tenderness?
No.
Okay, so I'm going to have you do your heel to shin. So you're going to take this heel and rub it against your shin. Very good. Now I'm going to have you do it on your other side. Okay, very good. So now I'm going to have you test the range of motion in your lower half, your extremities, okay? So I'm going to have you bring your left leg up, right leg up. Can you put your knees to your chest? Can you move your ankles in circles for me? Move them back and forth, up and down. So I'm going to have you push up with your legs on my hands. And push down. Very good. Now push up with your ankles, your feet. Now push down. Very good. So now we're going to also check your hips. We're going to rotate them, okay? So I'm going to have you just bend, abduct, and adduct them. Very good. Very good. And now, so his range of motion in his lower extremities are all equal, and strength is 5+. Now we're going to, while we're down here, we're going to check your Babinski's reflex to make sure you don't have one, okay? So what I'm looking for is I'm going to rub the back of this on his bottom of his feet, and we don't want his toes to fan. Okay? So So there's no fanning of the toes, which means that there is a negative Babinski's reflex. So I'm going to have you sit up now, okay? I'm going to have you face me. We're just going to have you test the range of motion of your shoulders. So we're going to have you just put your arms back like this. You stick your arms out, make some circles. Put your arms over your head. Very good. Cross your arms. Good, good. And now we're going to have you bend your arms like that. Go like pronate and supinate. Very good. Move your wrist. Now I want you to bend your arms. Push against me. Very good. Now what we're going to do is I'm going to have you touch your nose. Use your index finger and touch your nose, and you're just going to alternate with both hands, okay? Very good. Very good. Shows that sensory is intact. I'm going to have you squeeze my fingers too. Grips are equal bilaterally, and then the range of motion of his upper extremities is equal, and strength is 5+. So now we're going to test for sternosis. So what I'm going to have you do is close your eyes, and I want you to tell me what I'm going to put, what I put in your hand, okay? So can I see one of your hands? Very good.
P,
Now we're going to test your next hand, okay?
P, coin.
That shows that sternosis is present. Next, we're going to check for graphesthesia, okay? So I want you to close your eyes and tell me what I draw in your hand.
Okay. 8,
Okay?
3.
Very good. So graphesthesia is present. So we're going to do right now rapid arm alternating movements. Okay, so I want you to just do this. Very good. So those movements are smooth, showing that cerebral function is intact. Next, what we're going to do is we're going to test your deep tendon reflexes. Okay. So we're going to start by doing the bicep. Okay. Tricep. The brachio. Very good. We're going to do it on the other side now. The bicep, tricep, brachial. Now we're going to move down to the patella. Now we're going to do the Achilles. Very good. So this shows that all the deep tendon reflexes are all intact and equal bilaterally. So now last part of the test, what we're going to do is we're going to have you walk. We want to make sure that you have a steady gait. Okay, so I'm going to have you walk over there. Very good. Walk back to me on your heels. Now walk on your toes. This shows that his sensory function is intact. We're going to have you also, I'm going to have you hold your hands out. We're going to do the Romberg test now. Close your eyes and hold your hands out. Make sure it's steady. Okay, gait is steady. Last thing I want to do is you can open your eyes. I want to just check your spine. Okay, so I'm going to have you bend and touch your toes. Very good. There's no curvature of the spine. It's equal. Is there any tenderness?
No.
Okay, very good. Have you stand up. Can you move to the left? Your spine, bend to the left. Very good. Bend to the right. Now twist back and forth. Any tenderness at all?
No.
So he has full range of motion in his spine. All right. So that completes the test today, the full head to toe assessment. Do you have any questions?
No.
Okay. It's very nice meeting you, Christopher. I'll be back in to go over your results, okay?
Great.